Hi, everyone. Welcome to today's installment of the weekly seminar. This week, we're doing an alumni panel with graduates from our MPH program. Quick to introduce myself, I'm Sam Buttimer. I don't know if a lot of you have actually met me. I'm taking over running the MPH program here. Today is my first day doing that, so I'm sure I'll be crossing a lot of your paths. Nice to meet you all. And I'm also going to be teaching health systems this I was going to say fall, but it is not fall. It is very much the winter. So I'm sure I'll see a lot of faces there too. And for everyone online, welcome. Thanks for joining us today. So we're here with 5 recent graduates from our program. 2 will be joining us in person and 3 online. So it should be quite interesting to hear about their experiences, and also we're very thankful for them to take the time to come and speak with us. Just before we begin, I'd like to begin the seminar by acknowledging that Queens is situated on traditional Anishinaabe and Haudenosaunee territory, and that we're grateful to be able to live, learn, and play on these lands. All right, so our panelists, first Oh, hi, Colleen. Nice to see you too in the chat. First, I'd like to introduce Madeline Dara. She's a senior policy advisor with the Ministry of Citizenship and Multiculturalism, Anti-Racism Directorate here in Ontario. She's joining us virtually. Hi, Madeline. Next, we have David Riding, and he's a program IPAC specialist with Public Health Ontario. Hi, David.
Hello.
Carolina Neves is a community health and education specialist with the Center for Addiction and Mental Health. Hi, Carolina. She's joining us virtually today. Emily Mullins is a knowledge broker with Providence Care, the Centers for Studies on Aging. Hi, Emily. And Shannon Russell, who's joining us here today. She's a public health promoter with the Substance Use and Mental Wellbeing group at KFL&A Public Health here in Kingston. Welcome, Shannon.
Thank you.
All right, so we're going to be going through some questions for all of our panelists, and then we're going to save a little bit of time at the end for questions. So if you do have questions and you're online, feel free to type them into the chat, and we'll be checking those at the end, or in person, you'll be able to raise your hand and ask questions at the end. So to start, why don't we begin with Madeline? You can tell us a little bit about yourself and your job role, including where your organization fits within the public health system.
Hi, can everyone hear me? Wonderful, thanks, Samantha. So as mentioned, my name is Maddie. My pronouns are she, her, and I got my MPH in 2020. I am now a senior policy advisor for Indigenous Relations and Policy in Ontario's Anti-Racism Directorate, which is in the Ministry of Citizenship and Multiculturalism. And I work and I live on Treaty 13 and Williams Treaty territories. So government is obviously a key player in the public health system, a key driver, and I think the Anti-Racism Directorate has a unique role to play in public health for its mandate to lead a government-wide mandate to lead provincial anti-racism initiatives, programs, and education to identify, address, and prevent systemic racism in government policy, legislation, programs, and services. And so we do this through robust race-based data collection enabled by the anti-racism data standards, designing anti-racism impact assessments for policy. So this is similar to the health equity impact assessment, and through the delivery of the anti-racism strategic plan. And ultimately the goal is to dismantle racist systemic barriers, which include barriers that stand in the way of equal and equitable health status, self-determination, community well-being, and we do this among intersecting sectors such as housing, health, education, and more. So that's the role that I think I play and my team plays in the health system.
Thank you. Next up, David, if you could tell us a little bit about your role and how it fits in the public health system.
Of course, welcome everybody, and nice to be here and to chat. So I am an alumni of the first cohort of this program back 2009 and 2010, and so I've kind of charted a course, a career course since then in different places. So my current role is I'm an acting team lead for the Outbreak Response and Support Team at Public Health Ontario. And the primary role that our team plays is supporting stakeholders across the continuum of healthcare at a provincial level as opposed to a local level per se. Kind of the bread and butter work that we do are infection prevention and control lapse risk assessments. And so where a health unit is investigating a IPAC lapse as a result of a complaint in a physician's office, a doctor's office, tattoo parlor, or otherwise, if they, in the course of their investigation, are kind of struggling to figure out what is the risk of potential bloodborne pathogen transmission, they can reach out to our team and we can support them in that assessment. We can bring in IPAC physicians, IPAC specialists, and create a risk assessment report for their consideration. So that's a lot of the work we do in our specific team. And then we also provide a lot of IPAC consultation in terms of the recent monkeypox outbreak. We help provide the IPAC lens in terms of the guidance documents, as well as Ebola was kind of emerging in Africa again. We were able to provide some support in terms of the best practice for potential IPAC considerations in there as well. And then a big component of the work that we do is working with long-term care and acute care who are struggling with ongoing transmission of hospital-acquired or healthcare-acquired infections like MRSA, VRE, or C. difficile, or C. auris is another one that's kind of trending as well, unfortunately. We can provide some consultation. So that's a big part of the role that we do on our team at Public Health Ontario. And I guess, like, for those who, I should have this memorized, I guess, but in terms of Public Health Ontario's kind of mission and mandate, PHO's mission is to enable informed decisions and actions to protect and promote health and contribute to reducing health inequities. And then to do that, our mandate is we provide that science and technical advice and support to clients working in government, public health, as well as healthcare and related sectors. So that is kind of how we achieve that in our world in terms of infection prevention and control.
Great, thank you. Carolina, next from you, if you could tell us a little bit about your current role and how it fits within the public health system.
Yeah, so hi everyone. So I am a community health and education specialist with CAMH. So really what that means is I work a lot in knowledge translation. So specifically I work in at the nicotine dependent service at CAMH. There's a lot of different kind of departments, but I work at the NDS, and we're kind of like a hub for smoking treatment, vaping, treatment, research, and education. So my role specifically involves knowledge translation and research. So I work to develop resources, do research, courses, etc., for both practitioners and clients, kind of all within the realm of tobacco prevention and control. CAMH is a publicly funded psychiatric teaching hospital. So it is like, there are clinical patients as well, but I work under like the research arm. And it is the largest mental health and research center in the country. So there are a lot of, you know, kind of cutting edge research projects and really interesting intersectional research being done at CAMH. So yeah, that's kind of a little look into my role.
Thank you. Emily, you can tell us a little bit about your role.
Great, thanks. Yeah, so my name is Emily Mullins, and I work as a knowledge broker with the Centre for Studies in Aging and Health at Providence Care Hospital in Kingston, Ontario. So in my role, I work primarily on the Ontario Age-Friendly Communities Outreach Program, which is a provincial knowledge translation and exchange program. And we support 70 communities across the province in their age-friendly planning and implementation. And we're funded by the Ministry for Seniors and Accessibility. So similar to Carolina, my role involves a lot of knowledge translation and exchange work.
Thank you. And finally, Shannon, if you could tell us a little bit about your role.
Hi everyone, nice to meet you. I'm Shannon and I am a public health promoter at KFL Public Health. Obviously you guys are probably very aware with where the health unit fits into the health system. But I am on the substance use health and mental well-being team. The way our team is set up is we've divided it between unregulated substance use and regulated substance use. So I work on the regulated substance use team. Primarily, our goal is to use local data and resources in order to inform our program planning, implementation, and development. But yeah, it's a great area to work in. I'm currently focusing on cannabis and tobacco program planning phase for sure.
Wonderful, thank you so much. So the next question that's broad for everyone, and hopefully you'll all have something to speak to. If you can think back to when you finished your MPH here at Queen's, so for some of you a little bit longer than others, what were the key steps between graduation, or I guess if you got the job before graduation, between finishing your MPH and reaching this job that you're in now? Does anyone want to speak to it first?
I can go ahead.
Great.
So yeah, I graduated December 2020. And then I went right from my undergrad into my master's. So I told my parents, I was like, don't ask me about job stuff for at least a month. I need some time, like I needed a mental break. And thankfully my parents, they have a dairy farm. So I was able to work on the farm for a month and not have to think about anything, which was really good for me. And I really appreciated that time. And then February 1st came around and they're like, okay, your 9 to 5 is now applying for jobs. And that's really, really what it was. And I had goals for how many job applications I was sending out there every week. And it really was, it's a lot of work. I don't know if you guys have, Bren always taught us this. She was like, every time you apply for a job, like keep the job posting, track everything in an Excel document. And I did, and it like helped so much because you're putting so much out there. It's like, okay, now I have an interview. What did I apply for? Because you're applying to so many things. So that Excel spreadsheet during those couple months while I was applying for stuff really, really helped a lot. And then in March, I got a job working as a health promoter at Peterborough Public Health. I was given a COVID portfolio. I worked on the liaison team. It was a contract position. It was 6 months initially, but it got extended 3 times, thankfully, due to the funding that was being allocated to the health units. In that role, like I said, I was on the liaison team, so I learned a lot, particularly when it comes to working with community stakeholders and community partnerships. I was constantly involved with what actions people were taking policy and teaching them how to implement it. I worked specifically with the long-term care homes, retirement homes, and congregate care settings. And then I got to a point where I was like, okay, I've loved working in COVID, but I would like to do something else. And so kind of on the side there, I was just casually looking for other job opportunities that weren't in the realm of COVID. And thankfully this position at KFLNA came up, and it was in substance use health. It's also a permanent position, which was great. But definitely a lot of those skills, I'm really thankful for that first position that I was given at Peterborough Public Health. I didn't have any, other than my practicum, which I did with CNIB, I didn't have any public health work experience. And so getting that first position really then helped me to gain those skills as I went along to get the job that I'm currently in.
Yeah, and a bit of foot in the door.
Yes,
Yeah,
definitely.
absolutely. That's fantastic. Well, great, thank you. Anyone want to go next?
I'm happy to.
Sure, great.
Yeah, so in terms of my experience is a little bit different. So when I joined the MPH program, I actually had a leave of absence from my permanent position at the health unit. So prior to my master's, I have an undergrad in health science from Western, and then a public health degree from Ryerson, now formerly known as Ryerson, I guess, the Toronto Metropolitan University in public health. So I was actually working as a public health inspector at the health unit next door in Hastings prior to joining. And so as a result of the leave of absence, as soon as I had the fortune of finishing the program and then returning to my position back. So very fortunate, very appreciative of the time that the health unit afforded to me to take the program. So, but in terms of kind of the career kind of path from there, what I think looking back, what really was able to open many doors was really getting involved in other organizations as well. So I joined serendipitously, being a health inspector. I knew I wasn't really one of like kind of the kind of true enforcement type inspectors. I really enjoyed the education and the support realm of things. And so I actually worked in the communicable disease team, fortunately, and that really gave me that opportunity to do a lot of case and contract management, and I really enjoyed that. But I was looking around at my colleagues who were showing a real interest in infection prevention and control and had some certifications in infection control that intrigued me. So I'm like, well, if they're succeeding in that, what does that mean for me? And so looking around at colleagues, but opening the doors for infection prevention and control really happened when I joined a local organization called IPAC Eastern Ontario, and it's a sub group of IPAC Canada. And so for me, career doors really open as you look for opportunities to join organizations and to get involved, both at the organization you're in, to look at different opportunities, work with a variety of colleagues to see different potential public health opportunities, but also outside of your organization as well. And so IPAC Canada really did open those doors, and it gave me quite a bit of experience to really push my own interest in my own pursuit at some of the projects that I was interested in at the health unit, and then from there, opening my doors that way.
That's great. That's such a good point that there's a big element of networking that plays into a lot of job searching and getting a job. And that those networks that you build are fantastic. Great. Anyone virtually want to comment on that question, or we can move on? See, Emily is unmuted.
Yeah, I can also give my thoughts. So following graduation, like Shannon said, I applied to many different positions, took lots of work, and I got my foot in the door at the Canadian Cancer Society as a researcher working in tobacco control, specifically working in cigarette package health warnings and looking at those internationally. And so when I applied for the position, I really leveraged my practicum experience working with a national charitable organization, which was the Canadian National Institute for the Blind. And then after finishing that contract position, which was 10 months, I accepted another contract with the Samuel Center for Social Connectedness as a research fellow, working in exploring digital literacy among older adults. And that was really my field of interest, is gerontology. So through that experience, I was able to gain some relevant experience in gerontology, which led to my current role, which is with aging and health at the Center for Studies in Aging and Health at Providence Care.
Thank you. Madeline or Carolina, do you want to speak to this?
Yeah, I don't have too much new, not too much new stuff to add, but like Shannon said, I really wanted to emphasize the rest point. I think like getting some time off if you're able to really helped me get some perspective on kind of what my next steps were going to be. So that time was really valuable for me. I also spent, and I know you do some of this also during coursework, but I spent some time refining my resume, my cover letter, and my LinkedIn profile. I found a lot of jobs on LinkedIn, so that's really what I use primarily when I was applying for jobs. So just getting my profile like fully up to date with like a photo and like, you know, building connections in the field, even on LinkedIn, I found was really useful. And connecting with others in the field, however kind of I was able to. I didn't really have any connections like prior to looking for jobs, so it was kind of a shot in the dark for me. So my current job is actually the job I got kind of right out of school, so I'm still, it's about 2 years I've been in this position. And it was actually one of the first positions I applied for, and I didn't hear back for like a month, and then they like kind of got back to me. So really don't give up if you don't hear. Like after a while, it was one of the first jobs I applied to, and it ended up working out. But yeah, so just I would say a lot of applying, not as many interviews, and then yeah, just really like I don't know, keeping like hope. I think the job process can be really like the application process can be really tough. So just yeah, just be kind to yourself, I think.
Great, absolutely great points. I think keeping in mind that there's going to be a lot of jobs that they might not think you're the right fit for, and it doesn't mean you're not a good candidate for a job out there somewhere. Really keeping up that momentum is really important. Yeah, Malin.
Sure. I work for government, and anyone who's applied for government or interacted with government might know that government hiring processes, federal and provincial, are a bit of a whirlwind, and I could connect one-on-one with anyone to talk you through it if you ever need it. I'll put my email in the chat after. But I finished my courses in December 2019, and then in January 2020, I applied for the Ontario Internship Program, which is a one-year paid internship program that kind of builds up skills among new graduates to work in government in different sectors such as policy development, program development, communications, IT, all of these things. And it was a bit of an intense kind of 3-stage, months long interview process, and it was a bit discouraging at times, but ultimately it centered on a few screening assignments, written interview and presentation on a policy proposal that you developed. And I was fresh out of my MPH, and we were fresh out of learning about the changes that were going to happen to the public health system. So we thought at the time that the public health units were going to get dissolved and that we would have the Ontario health team. So my policy proposal focused around that, and I think the specificity really helped. And so I screened in and started my internship in August of 2020. Between graduating and starting, it was just a lot of sitting at home, as we all did in early 2020. A lot of resting, a lot of soul searching about what I wanted to do. And I was hired as an intern in Indigenous health policy at the Ministry of Health. And so that shop is responsible for coordinating among multiple ministries and among the ministry itself, different health portfolios and initiatives in primary care, mental health and wellness, and among kind of other priorities as well. But the specific things that I worked on was convening a table of mental health and addiction system coordinators from various Indigenous organizations. I also worked on the First Nations Health Transformation File. So that was an Indigenous-led initiative to explore opportunities for First Nation governments in Ontario to lead their own health systems and design their own health systems by their communities for their communities. And that was really amazing and interesting work. And I think what really drove the work we did was very soon after I started was when Joyce Echaquan died in Quebec. And I'm hoping everybody knows her story and knows her voice and knows the impact that she's had. But her death as a result of racism in the health system really drove us to start exploring systemic change in the health system. And so ultimately, that's what drove me to my current role. I was looking at what we were doing in health and realizing that it was intersecting with all sectors across the province: housing, education. All of these things were contributing to inequitable health outcomes, contributing to racism in the system, systemic barriers, and it killing people. And so I happen to know someone in the anti-racism directorate who put my name forward for the role, and I spent about a year and a half at the Ministry of Health, working more directly on health files. And in this year, in July, I got the opportunity to start working at a systems level, which I'm incredibly grateful for. So I would echo the things that people have said: rest, give yourself credit. You don't have to know everything right away. I really appreciated doing an internship because they really taught me the skills that I needed to be a part of the institution that I was working in. And that has just been a little bit of my journey.
Great, thank you. Did you know you wanted to work in government while you were doing your MPH, or was that something you started exploring right after?
Oh, definitely not. I graduated my undergrad in 2018, and that's when we learned that, the Premier was going to change the sex ed curriculum and kind of undo a lot of really good community-focused work. And so at that time, I understood government, and I still understand government to be a source of harm for communities across Ontario. And it was the internship that kind of enabled me to explore the possibility. And I don't think I would have taken the job if I hadn't been offered a role kind of to do policy differently in an Indigenous health policy shop with, I think, people who are really kind of radically committed to upending the business as usual procedures. And I've kind of stayed on that path. And I think that's the only reason I'm in government. I don't think I would be if I were somewhere else. And that's just the truth. But there is an opportunity within to make change from within. And then, I see myself as a partner to communities who are advocating for change from outside government as well. So I wasn't expecting it, but I'm grateful for the opportunities that I've had within this role.
It sounds like you're doing really interesting, transformative work. Okay, so next question. What do you like the most about the role that you're in now? And what do you find the most challenging, unexpected, or surprising? You can feel free to answer the first half of the question, the second half, or both.
Happy to go. I think one thing that I like the most about my role is that I'm always learning. My job is very dynamic. I realized after leaving school kind of how much I loved being a student and how much I loved learning. And I think when you get into the workplace, sometimes you expect that to stop, but for me it didn't. I think I've had a lot of opportunities for professional development that have really allowed me to gain other skills, refine my current skills, etc. My job is also project-based, so we get funding. We're soft funded, so we get funding from Public Health Agency of Canada, Health Canada, Canadian Cancer Society, other organizations to do projects. So that really allows me to, for example, right now I'm working on a Health Canada project for the next few months, but then I know coming up I'll be working on a CCS project. So it's because it's always changing. It kind of allows me to always keep learning. And being able to be part of the entire life cycle of a project is really exciting. So going from applying for grants and funding to developing the work plan to the project group, etc. That's kind of given me a really broad perspective on kind of how things go from the ground up. And it's allowed me to collaborate with a lot of external stakeholders. So yeah, that's been great. And I'll leave the rest of the questions for others.
One thing that I really love about my job is that I get to work directly with our knowledge management team at the health unit. That's where our epidemiologists and our data analysts are. And the data that I'm asking for is local data. It's data that they're getting from the hospitals, from the community directly. And I get to use that data to inform my program planning. And I really love that aspect of my work, that I know that this is going to directly impact, hopefully, these people that are within this sector. And another part of my job that I really, really like is, for those of you that know me, know that I love talking to people. I'm definitely a people person. I was in 4th year university here at Queen's, and I took Duncan's 301 Intro to Epi course, and I absolutely loved it. I had no idea what I was going to do after undergrad. And he was like, Shannon, public health. You love people and you love health, and this is just where you need to go. And anytime I'm given an opportunity to get out into the community and talk to people and maybe answer their questions and help them along their health journey, that is absolutely an aspect of it that I love. I can talk to something that was surprising when I started in my role, specifically whenever I was at Peterborough Public Health. This was obviously during the pandemic. I worked directly with a lot of family members because I was working with long-term care homes and retirement homes, right? And this was an area of the public where restrictions and regulations have always been super strict. And I wasn't used to my work being available for such public scrutiny, basically. I was being held accountable for things that people who don't understand the healthcare system are like, why are you making these rules? Keeping my loved one in this kind of situation, right? And for somebody like myself who cares about people and wants to help people, it was just kind of an eye-opening experience for me to be under that kind of lens from the community. It's like, well, why are you doing this? And it was just definitely a unique thing for anyone who was working during the pandemic to go through, but it was definitely something that caught me by surprise, and it was definitely a skill that I had to learn kind of on the go. It was my conflict resolution skills for sure.
Yeah, that's not necessarily what you think
No.
about when you're thinking about your role in training in an MPH, but anytime you're kind of interacting with people, that's front-facing role. It's
Yeah,
very
definitely.
different.
Very true.
Yeah. Anyone else have a challenge or kind of your favorite part to speak to?
I would like to build on that because I think I'm in agreement, like the people are the best part of my job. There is so much to learn from people, and what I think especially drives me and kind of gets me up out of bed every day to work from home is that I really like relationship building and partner engagement. And I think in order to take kind of a real and robust population or public health lens on an issue, you really need to understand that the people you're doing this for and with. And so you do that best through meaningful partnership building. And I think maybe just a couple of challenges that I'll highlight. I think there's a lot of parts of my job that are really challenging. One is definitely kind of balancing all the drivers and voices for change in the system. So the mandate of the government of the day, grassroots and community organizers, formal partners and stakeholders, nonprofits, academics, researchers, federal and municipal governments, traditional and First Nations, Métis, Inuit organizations and governments as well. Because, you know, some voices and communities have been more centered in this policy design process than others. And so much of my work involves this challenge of upending business as usual, utilizing an anti-racism lens to prioritize the voices of communities who have been traditionally excluded. And ultimately support them to achieve their own visions of equity, justice, and inclusion, and kind of work to merge that with the existing political priorities. And ultimately, the most challenging thing is that broad systemic change does not happen overnight, especially within a colonial institution like government. And so it's just having to take a moment almost every day to recognize that even if you're shifting the needle a little bit every day, you're still shifting the needle. And so those are the challenges that I'm facing, but very worthwhile challenges.
Absolutely. That's that perspective shift of shifting the needle. I think a lot of us in public health agree that that's kind of the lens you need to take to feel that the work you're doing is making a difference. Emily, anything from you?
Yeah, I can speak to something that I like most about my role is the variety that comes with my position. So there are some key activities that I'm responsible on an ongoing basis, but I often get pulled into new research projects or partnerships. So for example, currently my team is working on an exciting project with Queen's Department of Professional Studies to develop a set of e-learning modules for communities to learn about age-friendly community implementation and planning. And I'm very fortunate to work with a great team that shares my interest in aging and health. But on the flip side of that, as a knowledge broker, part of my role is to respond to inquiries and questions from age-friendly communities. And I think that's what I find most unexpected or surprising is that you can't predict what they're going to ask. So for example, recently I was asked by a community for examples of community needs assessment questions or how to apply for charitable status. So I'm constantly learning and it keeps the job interesting.
Great, thanks. And David, any thoughts from you?
Yeah, in terms of, I kind of touched on a little bit in terms of just understanding what drives me is I really like the stakeholder relationship, but also seeing an impact of the work that you're doing and seeing it kind of inform change or have an impact on the work that our colleagues are doing. So for us, for example, these infection prevention control risk assessment reports, it's really satisfying when you've poured in, gone through the evidence and put together what you feel is a sound risk assessment, and you present it to the stakeholders, and then it's the reception that you get, the challenging questions that come as a result, but also the potential impact that it has on true community members. By the way, is super satisfying. And it actually dovetails nicely into the challenge. And the hardest part too is that for us in infection prevention and control, like, we're the furthest from something being black and white. We live in the gray the whole time. And so like being able to really pour through and make an evidence-informed decision when there's lack of evidence is really challenging, but really rewarding when it kind of makes sense and everybody's kind of on board at the end. So it's a challenge and a reward at the same time, working through that gray area for sure.
So that actually leads nicely into our next question. And I imagine you can speak to this. What skills and knowledge do you use most then in your current role?
Yeah.
Particularly stuff you picked up during your MPH.
Yeah, critical appraisal is absolutely essential in terms of being able to, especially in where there is a dearth of evidence, to really appraise that literature, to be like, is this actually informative or not? Because when you don't have a big body of evidence to work from, it really has an impact. If it's poorly designed study and you could be relying on presenting information that just isn't quote unquote true. So critical appraisal is key. The other one is really distilling information, like scientific and technical information, and being able to communicate it clearly to stakeholders in a way that can affect change is a big skill set that we took from these programs all throughout, because we're pouring in so many projects and things throughout the MPH program, and then have to present it to our colleagues or do some seminars and so on. And that skill set really set us up for success in the real world, because that's what we're doing. We're communicating it to stakeholders, and being able to kind of the biostats, as challenging as those courses are, you have no idea the skill set that you're actually picking up in terms of being able to see and understand the data and being able to kind of tell the story from it. So the epi and the biostats courses really allow you to communicate really tough numbers and information again, and tell the story, and to be able to kind of pass it on to stakeholders. So those are some of the skill sets that directly apply from the MPH right into the day-to-day work.
Yeah, great. Carolina, you mentioned you've been working on projects from kind of the beginning to the end. What have you found most useful from your MPH in terms of working on that area?
Yeah, that's a great question. I think critical appraisal, that was the one thing I was gonna make sure to mention. It's already been mentioned.
Nods.
Yeah, I think that's like one of the most important skills I learned during my time at Queen's, and I still use every day. Same with epi and stats. For example, part of my role involves evaluation and analysis at the kind of end stage of projects, and so getting to incorporate some of that knowledge is really useful. I think other skills like communication, I know that sounds so trivial, but truly you really do refine it so much throughout your work. And because you work with so many different types of people, it's something that seems trivial, but it's so important. And I think one thing I wanted to mention to this kind of audience is just during my time at Queen's, I feel like I learned so much from my classmates. And from their experiences and their practicums, and really just having so many different perspectives and engaging in that collaborative learning, I think really kind of mimicked what the workplace was like, because you never know who you're going to work with. And I think that, when you have just people in the same room who are passionate about the same things, it's really awesome. So really just engaging in that collaborative learning while I was actually in my master's was really important to me.
Adeline, you're working in a bit of a different work environment than a lot of people might end up in after an MPH. What do you think your MPH lent to the work you're doing now?
That's a really good question because the link might not always be clear. And so I think it's important to kind of deep dive into that. I took a look at the public health core competencies and thought about what I use every day, and it really is all of them. But especially, there's the traditionally defined as, hard skills like policy, program planning, implementation and evaluation, assessment and analysis, and partnerships, collaboration and advocacy. Those are the ones that I'm using every day. Policy is very dynamic. It's a lot of, stakeholder relationships, briefing up senior leadership, diving into the evidence, presenting evidence-informed policy. And so the research skills were incredibly important. But I would say, kind of what are usually defined as softer skills like communication, the diversity pillar, the core competencies, and leadership. Like I couldn't do any of those hard skills without the softer skills, especially when relationships, respect, trust are so central to what I do. I think those are incredibly important and they're difficult to refine, but they're absolutely essential to the place that I work. But I think in addition to those, like I think skills and knowledge of qualitative methods has been especially helpful for me. A lot of stakeholder engagement is basically just qualitative engagement, qualitative research. And so knowing specifically about Indigenous methodologies in order to incorporate those to make kind of an accessible and equitable policy process. Personal reflexivity is a skill, knowing where you're coming from, knowing your biases, knowing what impact your experiences are going to have on the policies that you develop is incredibly important. Having a foundation in the social determinants of health and of global health. Thank you, Colleen. Those were incredibly important, especially Indigenous and decolonial perspectives, because I think they offered me a very critical lens on the institution and systems that I'm working in. And these are the systems that you all will be working in or are currently working in. And that's not just government, but hospitals, nonprofits, research institutions. Colonialism is embedded everywhere. And it's really important to me, I think, to have those personal reflexivity skills and a really, really solid foundation in social determinants of health.
Shannon, you also spoke to this a little bit, how some of the stuff you did in your training was useful for your job. Do you want to expand?
I echo everything that has been said so far. I'm trying to think of what hasn't been said so far, but I'm lucky in that at KFLNA Public Health, we are assigned to complete individual performance plans for our coming work year. And those performance plans are based off of organizational competencies and the public health competencies. And so it's a good way to frame and to ensure that our actions and what we're planning on working on aligns with those public health competencies as we're going through projects. Definitely, I use right from the beginning, my communication skills were tried and tested, and I definitely learned a lot from those initial experiences. But being able to take information and to clearly and concisely bring it to your community partners is something that I've learned can make a huge difference when you're working on a project. Also, just for an example, like currently I'm working on a situational assessment around the health effects of cannabis, specifically in the KFLNA region. And I've broken that down into 3 components. So there's the EPI component that I had mentioned earlier, where we're using local data, and then I'm doing a literature review. So those research skills, and thankfully we have a great librarian at the health unit. We're the Eastern kind of central for the librarian hub, and they're great. They do the literature search for you, but then I have to analyze and critically appraise all the information, but they have this amazing resource that I'm very thankful for. And then the third part of it is a community collaborative. So ensuring that the funding that we're receiving is actually something that our municipal partners feel like is a need for their communities. But also, yeah, reflecting everything that everybody else has already mentioned. Those are all important skills. But definitely reflective practice, which Madeline had mentioned, is, it's just important to look back and reflect on the things that you've accomplished and the things that you want to make sure that are a priority moving forward, for sure.
So before we wrap up, one last line from each of you as to what your main piece of advice would be to MPH students listening now. If you don't feel you've already done that, I mean, I think a lot of that has been said, but if anyone has one last line to add in.
So for me, building on the learnings from the MPH program and then applying it at work, my two kind of takeaways would be, I kind of touched on it too, is really get involved. And when you're in your organization, it seems, again, quite simple, but getting involved with kind of organizational groups, so social committees or otherwise, getting on working groups to really expand your network within your organization, but outside as well. So getting involved with the union and otherwise, you don't know the experiences that you gain, but also the perspective that you can share. And then the other one is, for me, I've always been quite kind of hesitant, but it's really kind of looking to push yourself, like be okay to kind of realize what your limit is when you take on a project. It's okay to kind of fail because you're not really going to fail. You're protected by colleagues and otherwise, but figuring out what your limit is and really giving yourself like stretch goals really changes the scope and really shows you what you're capable of and where you can go. So those are the two things that it took me a while to figure that out. But really pushing yourself to kind of, when something kind of scares you, and I go for those too, like don't let it stop. So those are a couple of things that I've learned the hard way.
I can like piggyback on that too. It's that when like don't be afraid to apply for positions that you don't feel like you have the experience in. When you're applying, like they can see what skills you have, they can see what experience you have. And then if you do get hired into that position, and like I know for me, sometimes it was, oh, well, I don't have these skills. And they know who they hired and they know that you're capable of learning those skills. So it took me a while into like my job search process to realize like, no, like I could do this job and I just have to try and prove that to these people.
Yeah, that's actually a good point. So there's some gender differences on that. In general, women tend to think they need more experience and men tend to disregard criteria on job applications. So they'll see 5 years experience, only have 3, and the man would apply and the woman often would not. There are statistics on this, I don't remember what they are, but it's worthwhile to consider. If you think you have what it takes to do the job, even if you don't meet all the criteria, put your name forward. That's a really great point. I imagine there's also some racialized differences on that as well. So try to keep that in mind when you're applying. You don't have to have everything they're looking for. A lot of the time, a good candidate, they'll be willing to help train you and that sort of thing too. Any questions from the audience or on Zoom? Not seeing any burning questions on our Zoom participants. Emily, we haven't heard from you in a little bit. Any final thoughts for the group here?
Yeah, it's kind of similar to what Shannon said. I would say to have an open mind when searching for job opportunities. So even if a position isn't in your preferred field, you might find that you enjoy it and discover a new path. And if not, you'll still have transferable skills that you can use when applying for your next position.
Great point. Madeline, Carolina?
Yeah, just actually piggybacking off of what you just mentioned, I think imposter syndrome was something I struggled a lot with when I was kind of entering the job field. I was the youngest and the newest person in my whole department when I started. And I know a lot of new grads also kind of, are in that experience. So I really did feel like I lost my footing a bit at the beginning. But really just remember kind of like what Shannon said, like you've been chosen for a reason. And I think, your experience and knowledge and perspective is so invaluable. So yeah, that's just what I wanted to say. And if anyone has any questions, I'll put my email in the chat as well. Feel free to email me.
Great, wonderful. We're getting some emails typed into the chat, and thanks, Colleen. Yeah, we really appreciate you all for joining us today and giving your insights. I think it's incredibly valuable to hear about what the steps are. It can sometimes feel a little overwhelming to think about next steps after school. Sometimes school is the easiest option moving forward because it's kind of knowable, whereas the job world can be vast.
Yes.
So we really do appreciate you taking the time. Just for everyone to be aware, next Wednesday on January 20th, not next Wednesday, 2 Wednesdays from now, on January 25th at 12:30 will be the next Public Health Sciences Seminar with Dr. Christian Larson, a GIS-based approach to estimating potential agricultural pesticide exposure at the population level in Canada. That sounds quite fascinating, so we would love to see you there. Thank you so much.